How does Pisa syndrome affect breathing in Parkinson's? How does Pisa syndrome affect breathing in Parkinson's disease? This is an important question as it highlights the complexities of managing Parkinson's and its various symptoms. Pisa syndrome is a postural abnormality that leads to a noticeable bending of the trunk to one side. This condition typically worsens when a person is standing or walking, but it often improves when lying down. The underlying causes of this syndrome include muscular imbalances, sensory-motor dysfunction, and cognitive changes that affect how individuals perceive space and control their movements. When it comes to breathing, Pisa syndrome can have several impacts. First, the lateral bending of the trunk can mechanically restrict the thorax. This alteration in posture affects the alignment and mobility of the rib cage and spine. As a result, the chest wall may not expand fully during inhalation, leading to decreased lung volumes and impaired ventilation. Additionally, individuals with Parkinson's disease often experience rigidity and slowness of movement, known as bradykinesia. In the case of Pisa syndrome, the imbalance of muscles on one side can further limit the function of the chest, while muscles that are essential for breathing, such as the intercostal muscles and accessory respiratory muscles. Moreover, the abnormal posture associated with Pisa syndrome can lead to discomfort and pain, which may cause individuals to adopt shallow breathing patterns. This shallow breathing can reduce the effectiveness of the diaphragm, the primary muscle involved in breathing, by altering the mechanics of the trunk. In some instances, the spinal deformity linked to Pisa syndrome can lead to narrowing of the spinal canal, a condition known as stenosis. While this is less commonly documented, it may impact the nerves that control the respiratory muscles, further complicating breathing. Overall, Pisa syndrome contributes to respiratory challenges in people with Parkinson's disease by physically restricting chest wall movement and disrupting normal breathing mechanics. This situation can worsen the already heightened risk of respiratory complications in Parkinson's patients, such as reduced cough effectiveness and increased susceptibility to pneumonia. From a clinical standpoint, addressing Pisa syndrome through physical therapy, postural correction strategies, and appropriate medical management can help improve respiratory function and enhance quality of life. However, it is essential to recognize that the pathophysiology of Pisa syndrome is complex. It involves a combination of central nervous system dysfunction, musculoskeletal changes, and cognitive factors that affect posture control. In summary, Pisa syndrome affects breathing in Parkinson's disease primarily by causing lateral trunk flexion, which mechanically restricts chest expansion, disrupts respiratory muscle function, and contributes to inefficient ventilation. This can potentially worsen respiratory health in affected individuals. Always consult healthcare professionals for personalized advice and management strategies tailored to individual needs.